everyone's day so far? Nice to see everyone.
So far, so good. Good morning. Still.
Good. I'm 23 now.
All right, it is 12 o'clock, so we're going to get started because we have a full hour of content for you. Just a few reminders about GoToMeeting. You can share your camera or turn it off because we will have a presentation up the majority of the day. When you do want to go ahead and make a comment or a question, we do have time for that built in. Please use the chat box function for that. Thank you so much. Billy, take it away.
Well, thank you very much, Ashley, and good morning to everybody. Welcome to the Rotary District 7620 Virtual World Polio Day. I am Billy Lewis, President of the Prince George's County Rotary Club and Chair of the Polio Plus Program Committee. I want to take this time to give a warm thank you to the Polio Committee in planning, organizing, and promoting the Polio Plus program throughout the district and beyond. Our team members are, and I want to recognize each one of them: Bob Parkinson from Lexington Park, Bob Sotwell from Lakeshore, Ken Weiss from Gaithersburg, Sonia Liu from Metro Bethesda, and John Reed from the Potomac Rotary Club. All right. So let's go to the next slide here. Thank you. Back in September of 2015, the Rotarian magazine had this following open letter to polio. Dear Polio, we have bad news for you. Very, very, very bad news. Today we stand extremely close to eliminating you. And that was in 2015, September 2015. We still have more work to do, but we'll get there. Someday we'll live in a world where you no longer exist. So prepare to exit stage left. Adios, ciao, au revoir, sayonara, toodles, goodbye. Sincerely, Rotary. And since that time, I want to say that we've made tremendous progress. All right, so this is the intent of today's meeting, to show how we could combat polio, and we appreciate your participation. So right now, I'd like to present to you our district governor, Jimmy Gorski. Jimmy Gorski is a retired professional in the field of secondary and higher education for over 30 years, with expertise in such areas as curriculum development and language acquisition and development. She worked extensively in the area of standardized testing and supervised university master's degree candidates before moving full-time into educational administration to direct departments in institutional development and financial support. So, very accomplished individual. For the past 20 years, District Governor Jimmy Gorski has been a member of the Rotary Club of Upper Marlboro, Maryland, where she held numerous leadership positions within her club and within the district. At the beginning of this Rotary year, Jimmy Gorski was installed as governor of District 7620. And without further ado, I present to you District Governor Jimmy Gorski.
Thank you, Chairman Billy, for the work that you and your committee have done this year. And thank you for that warm introduction. Chuck Davidson is our first distinguished speaker today. He is a past district governor of Rotary International District 7610 and is currently the End Polio Now Coordinator for Zone 33N. During his 50 years as a Rotarian, he has held numerous leadership positions at the district and zone levels. including area governor, district trainer, district Rotary Foundation chair, member and later chair of the Zone Institute Executive Committee, and Zone 33 Assistant Regional Rotary Foundation Coordinator. At the international level, he has served as a member of the Host Organizing Committee for the Atlanta RI Convention, Roundtable Discussion Facilitator for the Rotary Reunion International Institute at the New Orleans RI Convention, and member of the Council on Legislation. Dr. Davidson holds a Bachelor of Science degree in chemistry from the Citadel and a PhD in nuclear chemistry from Florida State University. He spent 42 years in government service, culminating as director of the U.S. Army Nuclear and Chemical Agency. Included among his many awards are the Rotary Foundation's Citation for Meritorious Service and Rotary International Service Above Self Award. He and his wife, Nita, reside in Springfield, Virginia, and they have 3 sons and 2 grandsons. Please join me in welcoming Dr. Davidson to District 7620 World Polio Day celebration.
Thank you very much, Governor Jimmy. I appreciate that so much. I would like to say one thing at the outset. The picture that you just saw on the screen, some people have asked me that picture really looks like it's 10 years old or something like that. And I'd like to lay that to rest right now, once and for all. That picture is not 10 years old, it's 12 years old. So that's the way it is. You put on an older picture of you. It is World Polio Day. It's a big day. It's a big day for everybody in the Rotary world, and a big day for everybody in the Global Polio Eradication Initiative world. It's a day we're going to make history. We're going to celebrate the successes of what we've done right. We're going to review our plans to complete the fight and redouble our efforts where necessary in order to make sure that this, in fact, happens. And we are committed people. We're committed, we're motivated. I never see this lack anywhere I go around the zone to make talks. I see plenty of awareness. I see plenty of raising funds, but I do know that we're smart people, and smart people have got good questions. And it's important that we have the answers to these good questions so that when we are creating awareness and when we are in fact raising funds, that we can answer them when we're asked that by others as well. Next slide, please. I think it's important as we start off here just to remind ourselves of a couple of points, because these points will come up again as we answer the 4 questions that I get the most as I go around the zone. First of all, it's an infectious virus, not unlike COVID-19. There are 3 types of polio virus. Simply inoculating against one does not give you protection against the other 2 types. We're fortunate that the last 2 types, 2 and 3, are actually eradicated from the wild, although I will come back to that in a moment. It's a person-to-person spread, mostly by contaminated water. Attacks the nervous system, can lead to paralysis. About 1 in 200 people that are infected will actually see debilitating effects. And as most of you know, only Afghanistan and Pakistan are still countries that have the polio virus endemic, existing in the wild. Nigeria recently in August, and in fact the entirety of the continent of Africa are now wild polio free. No cure, but there is a vaccine. Next slide, please. Next slide, please. Here are the questions that I want to put a little bit of extra light on. The questions that I get, they're different from what I got a year ago, but they are important questions. They deal with the vaccine. They deal with where we're using the vaccine. They deal with what is causing the increase in wild cases in the last 2 years, and also how is COVID-19 affecting the fight against polio. And I should state right here and now that when we talk about years in the polio world, we're talking about calendar years, not Rotary years. Next slide, please. And here's the first slide. The question is, what is the vaccine that we're using right now? Many of us know, but perhaps not all as well as we should, there are two basic polio vaccines. One is a live but weakened polio vaccine that was developed by Dr. Sabin, and the other is a dead vaccine that was developed by Dr. Salk a little earlier than Dr. Sabin developed his live weakened vaccine. Why are we using the live weakened vaccine? For several reasons. One, it's cheap, very inexpensive. It's easy to administer. It's the one that we see pictures all the time of people administering 2 drops to a child. And maybe not so well known is the fact that the recipient unintentionally vaccinates or immunizes others simply because that live weakened vaccine passes through the vaccinated individual, and because of poor sanitation, perhaps gets into other individuals. And somewhere downstream in this circulating vaccine, the vaccine on rare circumstances, the virus on rare circumstances, I should say, mutates and becomes something that can, in fact, paralyze people again. A rare situation, but I'll talk about that in just a minute. There's a twofold plan that the World Health Organization and others have in the Global Polio Eradication Initiative, and that is to switch to an oral vaccine that can't mutate. That's point one. And then eventually to switch to the dead injectable vaccine, the Salk vaccine, as soon as the wild polio virus has been interrupted. Next slide, please. I think here it's important to talk just for a minute about one of the vaccine situations that we have, and that is the so-called vaccine-derived cases that I just spoke about. Take a look at this chart, if you will. I know you can't see the fine print on the chart there, but down near the bottom, near the right, to where you see almost no cases of vaccine-derived polio, we got to the point that we had almost none of those particular rare mutations that could occur. And after significant amount of study and modeling, it was decided that it made sense to switch from a vaccine that attacked all 3 types, types 1, 2, and 3, and instead forget about a vaccine having type 2 in it, type 2 vaccine in it, because that was the type 2 virus that was in fact most of the time occurring in vaccine-derived cases. And so that was decided, and in 2016, 5 years ago, the switch was made from a trivalent to a bivalent vaccine where there was no type 2 vaccine in it. You would think right then and there we would have stopped vaccine-derived cases of type 2, but unfortunately there was still type 2 vaccine out there in the system, in the sewage, in the contaminated water, and so forth. And there were vaccinations, viruses that mutated from that type 2 vaccine in the recirculating area and caused cases of vaccine-derived polio, specifically type 2. And then the other side of the two-edged sword kicked in. We weren't vaccinating anymore against type 2. And therefore, suddenly the type 2 vaccine, virus, I should say, in those cases started infecting people, and newly born children that were not vaccinated against the type 2 virus suddenly started catching that particular virus. And so in 2019, which is the last bar you see on that particular chart, it jumped way up into 378 cases, and right now in 2020, it's already exceeded over 500 cases. Now, this is a fractional, tiny percentage of the billions of doses of vaccine, but nevertheless, to those 378 or those over 500 people that got polio from a mutated vaccine, a virus that was out there in the poor sanitation area, this was not a good situation. It requires us to rush the development, the testing, and fielding of the genetically stable oral vaccine in order to avoid any more cases. Next slide, please. Locations. One of the questions that I get asked frequently is, we only down to 2 countries. I understand that. How come we're vaccinating in a couple of dozen, maybe even 30 countries, depending on the situation? And there's the plane that you see on this particular slide. You've heard it said many times, the virus is only one international plane ride away if there's someone on that airplane that is infected with the polio virus, perhaps not showing any symptoms whatsoever. And that virus can be carried by anyone who is infected, and it then emerges in some other countries. Also, vaccine-derived cases where we're constantly carrying out vaccinations because of the poor sanitation can contribute also to the fact that suddenly there is an arising of cases of vaccine-derived or cases that were carried on one international plane ride away. They had to do something about this because, simply spoken, viruses go where infected persons go. Next slide, please. So, why are suddenly there's more wild polio cases in calendar years 2019 and 2020? A very important question to ask. Down to just a little over 20 in 2017, 2018, and suddenly it's up in the hundreds. It's already at 130 or so with this particular calendar year. My own personal prediction is that that will certainly increase and to exceed 200 cases before this particular end of the year out. Why is it that we have this increase in wild polio cases in 2019 and 2020 when we were so close to stamping it out completely? Next slide, please. This slide has a particular bit of numbers on it, but the key point are the bullets that say why these cases suddenly increased. And I will say outside, right at the beginning, the bottom line here is the lack of access to vaccinate is the reason, pure and simple. If we cannot have access to the kids to be able to vaccinate them, they are going to come down with the polio virus until we get that last wild polio virus out of those 2 countries. In Pakistan, for example, as I have heard many people say, we've had cases where polio workers have been killed. This clearly discourages polio workers, vaccinators, of going into the hinterlands to deliver the vaccine to the people that need it. We've had several false propaganda cases that have taken place in Pakistan, cases of videos that wouldn't fool perhaps yourself and myself, but certainly have fooled the populace there in Pakistan to the point that hospitals were flooded with people who took their children to the hospital being concerned about their children who had been vaccinated recently and who were supposedly going to come down with some bad disease. This false propaganda caused people not to make their children available to be vaccinated. COVID-19 is also a culprit. If you can't go door to door because you're concerned about the infection of people inside or the infection of the workers themselves, you have a case where you have lack of access. Afghanistan, again, you have lack of access. The restrictions by the Taliban there are the things that in most cases cause this restricted access. COVID-19, lack of access to vaccinate is the main culprit as to why these cases have gone up in 2019 and 2020. Next slide, please, Ashley. Thank you. COVID-19, how is it affecting the fight against polio? We should actually be proud of this first part of this because the World Health Organization, the Global Polio Eradication Initiative said we have a moral imperative to take what is a superb infrastructure to fight polio and to apply that against COVID-19 when it certainly first became a pandemic, when it became an effort where we needed something like that. And in fact, that infrastructure has been applied previously to cases of Ebola in Africa, places of malaria, cases of yellow fever. That same infrastructure has been used. It made good sense, and we should be pleased, I think, of this, proud of the fact that the infrastructure which we funded had in fact been put to some use in knocking out COVID-19. Temporarily, because of COVID-19, of course, we had no access to places where we, house to house, where we could in fact provide that vaccine. And that was caused by COVID-19. That's now been resumed. House to house access has now been resumed with proper precautions, and vaccinations are now taking place. But in the meantime, during that period where house to house vaccinations were paused, we simply did not have access. Next slide, please. So what are the things we need to watch for now that we know the answers to those 4 questions that we get asked so frequently about? First of all, we need to watch for something that's going to take place, if it hasn't already, within a matter of weeks, and that's the fielding of a new genetically stable oral vaccine that should bring to a quick close the number of vaccine-derived cases of polio that we've seen such a resurgence of into the middle hundreds, 500 or so, in the last 2 years. We should watch for this. We should watch for this in the news, because as soon as this happens, this will make a big difference. That new vaccine has been developed. It's been tested successfully. It's under the manufacture, and billions of cases, billions of doses of this new oral vaccine that's genetically stable and will not mutate are in fact just about to be fielded. Also, the next thing we should look at, and this may take place in the next several months, is agreements with the 2 governments, the government of Pakistan, the government of Afghanistan. In the past, there have been instances where perhaps the governments were not as aggressive and necessary to fight false propaganda, to provide guards to the polio vaccinators that were going door to door in areas that were not totally controlled by the government. We will see government agreements that will be publicized that will assist the vaccinators and to allow us the access that we need to, in fact, get rid of that final wild polio virus that exists in Afghanistan and in Pakistan. And finally, we're going to see eventually, over the next several years, a country-by-country switch from any oral vaccine to the injectable dead vaccine where and when appropriate. We already see the cases of several developing countries. Mongolia comes to mind, where some of the vaccination protocol includes the dead vaccine that must be injected. It takes more effort and so forth. They cannot possibly create any type of vaccine-derived cases. We will see those 3 bullets in the next weeks, in the next months, in the next years. We should watch for those. In the meantime, what should we do about it? Next slide, please. And within the United States, of course, our business is to help fund the efforts. Right now, we cannot go on NIDs because of the COVID situation, but we should not stop, we must not stop the dollars that we provide. And in Zone 33, we have a series of goals that we are hoping that every single district, every single club will do within our Zone 33. For example, we want every club to have a goal in Rotary Club Central of at least $45 per member. Goals are important. Even more important, these goals must be written down. A goal that's written down is much more likely to be met than a goal that's just in someone's mind. Okay, it's important that we get these goals in Rotary Club Central, and I'm reminded that only 61% of clubs zone-wide in Zone 33 right now have a polio goal in Rotary Club Central. So to the extent that you can help with this at the district level, at the club level, get these goals written down within Rotary Club Central. Every club must contribute to Polio Plus to really make this thing work, okay? That's not the case right now. Last year, only a little under half of the clubs in our zone provided any contribution to the Polio Plus Fund during the year, during the Rotary year of 1920. This is something that we have to push hard to make sure happens in order for us to carry out this commitment. Public awareness is important. There's no better way to get support from within the community and get their contributions, but to let them know what it is we're doing to get rid of polio. And that's what Rotary's job is. We ask every single district to give 20% of their district designated funds to the polio cause, because this is matched extremely well by the World Fund and also by the Bill and Melinda Gates Foundation as well. Last year, 15 of the 17 districts within Zone 33 contributed at least 20% of their DDF, and every single district contributed substantially to that cause. We need that to continue for Rotary year 2021, because our overall goal within the zone is $2 million total, cash given by clubs and districts and DDF given by districts. Let me finish then with this last particular slide. I would like you to take a look at the slide, take a look at the kids that are in this particular photograph. They all look healthy. They've got smiles on their face. Some of them look like they're looking directly at me and probably looking directly at you. I see their knees are bent in a normal way. None of these kids have polio. It's up to us to make sure none of them ever does get polio. And I thank you. Slide off.
Thank you very much, Dr. Davidson. That was an outstanding presentation. And let's see if we have any questions for you.
We'll give everyone one moment, no questions at the time. Just so everyone knows, we will have question time at the end following our second presentation as well.
Okay, very good. At this time, let me go ahead and introduce to you Michel Zaffran. All right, Michel Zaffran is the Director of Polio Eradication at the World Health Organization, that's WHO, and he is the Chairman of the Strategy Committee of the Global Polio Eradication Initiative since 2016. So he joined WHO in 1987, where he has held several positions, including coordinator of the expanded program on immunization, and has led work in logistics, vaccine quality, and immunization financing. Michel represents WHO on the group that designed and launched Gavi, the Vaccine Alliance, and was Deputy Executive Secretary at Gavi during the period of 2006 to 2007. He is a French national born in Algeria. He is an engineer and holds a certificate in tropical epidemiology. He has worked in Morocco, Burkina Faso, DRC, and Ethiopia for the Paris-based Groupe de Recherche et Échange Technologique, or better known as GRET. Without further ado, I present to you Dr. Zaffran.
Thank you very much, Billy, and thank you very much for the invitation to speak to you today on this World Polio Day. It's a great honor to be able to present to you. I was asked to give a bit more information on the World Health Organization, which was on the news quite a bit in the US, and perhaps it's not a very well-known entity to you, but it is a big actor in the global polio eradication efforts alongside Rotary. So I will, in the next few minutes, try to explain what we are, what we're doing, who we are, and also how we interact with Rotary International. Next slide, please. So the World Health Organization is, this is what I'm going to, next please. Next slide, please. The World Health Organization is a specialized agency of the United Nations system. It was established in 1948 to actually focus on health. And for WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It has a mandate to promote international cooperation to improve public health. And it promotes the attainment of the highest possible levels of health by all people. It has about 7,000 staff in around 150 countries. Its headquarters is in Geneva, Switzerland. 194 member states are contributing to the World Health Organization. So we are serving as WHO 194 member states. Its budget for 2021 was approximately $4.8 billion. This is to be compared with the US Center for Disease Control budget for the same period of time, which was $13 billion. Next slide, please. So something that we've talked a lot about with regards to WHO is its relationship with the COVID pandemic and whether it did well or not well, sort of warning the world of what happened with the COVID-19. What's important to understand is that there is an international health regulation legislation, which is an instrument of international law, which is legally binding on 196 countries, including the 194 that are member states to WHO. And the idea is that this international health regulation creates rights and obligations for all countries that have signed on this IHR, including the requirement to report any public health event. The regulations also outline the criteria to determine whether or not an event will constitute what we call a public health emergency of international concern. And this is the highest possible level of alert under this international health regulation. WHO will sort of assess the situation and then issue this alert. There's nothing higher in terms of alert. Through the international health regulation, all countries that have signed up on this legislation have agreed to build their capacity to detect, assess, and report public health events. WHO plays a role of coordinator in this effort and together with its partners helps countries build the capacity. Next slide, please. WHO, no, please go back one. So WHO coordinates efforts across member states and shares technical guidance. It is quite important to understand that WHO has no legal authority over member states. We are the secretariat of a big group, which is basically the 194 states that are member to the organization. Next slide, please. So what has happened with the COVID-19 pandemic? And that's something that you've heard a lot in the news, I suppose. This is a little chronology of events. So I will ask you to click sort of several times. Please click. On 31 December 2019, the Wuhan Health Commissions issued a statement on cases of viral pneumonia. On 1st of January, WHO sort of launched out what it's called its incident management support team. That means that all WHO was sort of engaged in sort of requesting more information. We requested information from China. On the 2nd of January, WHO informed Global Outbreak Alert Response Network, which includes all major public health agencies across the world, of this new type of event. On the 5th of January, WHO advised all member states to take precautions to reduce risks with regards to this event. On the 11th of January, we had the first death caused by the coronavirus in China. Next. On 13th of January, we had the first report outside of China in Thailand. Next slide. On 16th January, Japan reports its first case. And the WHO Office for the Americas, which is in Washington, issues an alert for travelers. On 21 January, the USA reports its first case of coronavirus. On 23 January, the International Health Regulations Emergency Committee meets. 15 experts, including experts from the US, did not reach a conclusion. On the 24th January, the Pan American Health Organization urges countries to detect and isolate all cases of coronavirus. On 27 January, WHO Southeast Asia urges countries to focus on detection and prevention. On 28 January, WHO meets with the president of China and requests biological materials to better understand what this disease is. On the 31st of January, so that's basically 1 month after the first detection, the International Health Regulation Emergency Committee was convened again by WHO, and a public health emergency of international concern was declared. So 1 month after the first case. A public health emergency of international concern, you may recall, this is the highest level of alert that WHO can issue under the international health regulation. At that time, there were 98 cases of coronavirus outside China and no death outside China. Next slide. So WHO has been providing quite a lot of technical guidance since the start of this pandemic. We've issued 28 briefings and information sessions for all member states. May I remind you that the US is still a member state of WHO until July of next year. 90 media briefings were also organized, and all, of course, the transcripts and recordings are available online. We've convened international expert networks. We have opened a platform for training. We have issued information networks for epidemic. So a lot of information has been available in all sites of the World Health Organization. Next slide, please. Next slide, please. So this is just a little bit of a history on the coronavirus and how WHO has interacted with this, because a lot is not known. Now I would like to actually focus more on the interaction between WHO and Rotary International. As you know, the Global Polio Eradication Initiative is a public-private partnership which is led by the national governments of the countries that are affected, but also with 6 partners: WHO, UNICEF, Rotary International, the Center for Disease Control, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance. Next slide, please. WHO's role in the global polio eradication effort: we coordinate strategic planning, the management, and the administration of the efforts. We collect, collate, and disseminate information on strategy implementation, on the impact of the strategy implementation, and particularly in the area of surveillance and campaigns. We coordinate the research. Chuck mentioned that we have been involved in this novel vaccine that he referred to. We provide technical and operational support to ministries of health, and we help training and deployment of staff for technical assistance. We also played a lead role in the certification standards, surveillance of the paralysis and resource mobilization, as well as coordinating donor relationship and advocacy and communication. We are the secretariat for the certification process, and we facilitate implementation and monitoring of what we call biocontainment, so that the virus that are held in laboratories do not get out to the public. Next. And what is the role of Rotary in the global polio eradication? Rotary, and I'm a Rotarian myself, so I can also speak to that, is the world's largest humanitarian service organization with a global network of 1.2 million members in more than 170 countries. Rotary was the first to have the vision of a polio-free world as a primary responsibility that includes fundraising, advocacy, and volunteer recruitment. More than 1 million Rotary members have volunteered their time for national immunization days in a range of countries, but of course personal resources to polio eradication as well. Rotary members, they provide field support during national immunization days. They are one of the main private sector donor to the effort, and by the time the world will be certified polio-free, Rotary's contribution will have exceeded $2.7 billion, including $1.3 billion in matching funds from the Bill and Melinda Gates Foundation. Next slide, please. What is the impact of the USA decision to withdraw from WHO on the Global Polio Eradication Initiative? Our feeling is that, of course, we value extremely strongly the long and very successful collaboration and partnership with the USA in health in general and in the polio eradication effort. And this collaboration with the USA and the former USSR during the Cold War was what has enabled us as a world to eradicate the first human disease, smallpox. That was at the time that the tension was so high between these two countries. So certainly the withdrawal of the US, which is effective, will be effective if it indeed continues in May 2021, will represent a great loss for global health in terms of international collaboration and scientific exchanges, much more so than funding. Funding, of course, is important. It has been critical to the advancement of public health goals such as vaccines and immunizations, emergency response, tuberculosis, HIV/AIDS, malaria. So the loss of international collaboration and coordination, in spite of the loss of funding, will probably be the most hurtful to global public health, because what has been critical to the advancement of global public health is also the participation of US scientists who have been so engaged in sharing their knowledge and their technical expertise. Of course, WHO will continue to advance public health and fulfill its role within the mandates given by its member states. Next, please. Having said that, the withdrawal from WHO of the US is not a withdrawal from the Global Polio Eradication Initiative. The loss of funding to WHO for polio eradication for the biennium 2020-2021 is approximately $18 million. It is significant, but what is also significant is the fact that the US Center for Disease Control details staff and consultants for outbreak response campaigns, for laboratory operations and surveillance to the WHO. And of course, the loss of staff, in addition to the loss of funding, is going to be quite significant. So what we're doing in the context of the Global Polio Eradication Initiative is working closely with all partners, and as you've seen, there are 6 partners involved, and all donors, to find ways to actually minimize the financial impact on the program. Next slide. Having said that, you know, there's a lot of politics. In Rotary, we don't like to speak about politics, but this has been a very political discussion, the withdrawal of the US from WHO. What I want to bring us back to is the fact that, as Chuck has said, we are so close to eradicating polio. We need to continue to collaborate for a polio-free world. Next slide. In 1991, the last child to be paralyzed by the wild polio virus in the Americas was Luis Fermin Tenoria in Peru. Next. After that, Mom Chanti was the last little girl to be paralyzed in the Western Pacific region in Cambodia in 1997. Next slide. In Europe, the last kid to be paralyzed by polio was the little Melik Minas in Turkey in 1998. Next. Rocha Khatun from India in 2011 was the last kid to be paralyzed in India. India hasn't had a case of polio for the past 9 years, so an extraordinary achievement when we think that India would never achieve polio eradication given the difficulties that they have. 9 years without a single polio case. Next. And now Yafana Ali was the last little girl in Nigeria, in Africa, to be paralyzed by polio in 2016, in September 2016, 4 years ago, more than 4 years ago. So we are so close. We just need to continue to collaborate across the world for a polio-free world. Thank you very much.
Wow, that was absolutely outstanding. Thank you so much, Dr. Zaffran. And I know we have a lot of questions, and so we'll go straight to Ashley. Thank you.
Absolutely. So our first question, I believe this is for Dr. Davidson because it came in right after his, is can you say more about the government agreements you were mentioning?
Just unmuting myself, that's okay. I can't say anything more about the specifics. I only know that the people in Rotary, about what, 5-6 months ago, the chair of the trustees, the president of Rotary International, the head of the International Committee on Polio Plus, Mike McGovern, went over to the government of Pakistan to encourage them and to seek their active collaboration in helping to make the way where access would no longer be restricted. I guess you would say that when we're seeking political agreements, that's political, no question about that. Just to mention also that it's also political that the US and other countries spend a lot of time interfacing with the governing bodies in the Congress, US Congress, the Canadian Parliament, to seek funds from the governments in order to do that. We are interested in working with the governments because if the governments do not work with us, it will make the task much more difficult.
Thank you. Another question is, why is it referred to as wild?
I guess I would answer that, and maybe Michelle would like to add to it at the end, is that we simply mean it's a case of something that has no known source from another individual that is already infected with it. It's a fact of the matter that the polio virus can be traced just like DNA can be traced. The experts in the infrastructure can determine where any particular case of polio came from. Did it come from in the wild? That is to say, not from another individual who already had the case, or did it come from poor sanitation within the wells or of a particular country? They can determine this, and they know exactly where it's come from and whether it's coming from a vaccine-derived case from another individual, or whether or not it came from the wild, not from another individual.
Thank you. The next question is, to what extent will the National Immunization Days this year include the new vaccine?
Michelle, can you handle that better than I?
Yes, I certainly can try. I mean, the new vaccine should be authorized for use in, I would say, in the next few days. We're just waiting for the regulatory approval. Initially, we'll use it in campaigns, in national immunization days or supplemental immunization activities in a limited number of countries because we want to roll it out carefully, probably 3 countries. And then it will be sort of deployed, rolled out in a larger number of countries. So I would say that over the next 3 months in a small number of countries, perhaps 2 and 3, and then sort of next year, hopefully, if all goes well, it will be rolled out in all countries that are facing these outbreaks that you described so well, Chuck, of circulating vaccine-derived poliovirus type 2. Yes.
Thank you. How many children or people can be vaccinated with a $100 contribution by an individual Rotarian?
Well, we used to say that 50 cents is what it costs to fully vaccinate a child with 3 doses of oral polio vaccine. So you make the calculation, it's 200 kids can be vaccinated with $100 contribution. But if you make your contribution $200, then will be 400 kids. Just joking.
Can you please talk about how Rotary is and can move into an expanded phase of eradication and apply lessons learned from polio to COVID?
Well, I would certainly think that one lesson has already been applied, and that is the use of a surveillance structure, of the hardware and the software that's available to the infrastructure of polio throughout the world right now. The fact that that's been turned over for a while, or diverted, let's say, in large measure to COVID-19, is a great example of that particular thing. That will never stop. This is not the first time it's done that. We've done that, as we said earlier, from the standpoint of Ebola, and where it was not a pandemic, it basically stopped it dead in the tracks. This will continue, and it should continue. There is, as the GPEI and WHO would say, a moral imperative for us to make use of that infrastructure when it's necessary.
Thank you, and that answered a few other questions. Is there a website that we can go to and join a NID in the near future?
I will take that at least to start with, and that is, there is an individual, and I will put her email address in the chat box for you, but most of you know her, many of you know her. Her name is Nancy Barbie. She has led I don't know how many NIDs to India, and there are NIDs elsewhere too, but although NIDs have been temporarily halted because of COVID-19, she is the one who would have her finger best on the pulse within Zone 33 to say when the next NIDs are going to be done. And I will put her email address in the chat box.
How can we volunteer with polio eradication boots on the ground efforts?
Which ground are we speaking of? If we're speaking of where the polio is, we go by NIDs. That's boots on the ground there. However, boots on the ground in the United States is equally important. These boots on the ground are where we interface, at least virtually, with local governments. For World Polio Day, for example, there have already been a number of official promulgations by the state of Virginia, I know of, and by counties within the state of Virginia that in fact create public awareness. That is a type, I would guess, of boots on the ground. Let's call it virtual boots on the ground.
Do you think that the U.S. has opted out of the WHO because individuals do not understand what WHO is or what the polio virus is? Should we inform individuals of the United States to help global efforts in eradicating polio?
Michel?
Yeah, I think that's you know, there's a big tension internationally at the moment, and I would not sort of delve on sort of why the U.S. government has decided to withdraw from WHO. I will focus on the fact that we need international collaboration. We need sort of international exchange of information. We, of course, need to strengthen WHO if WHO is deemed to be not strong enough. But we need this international collaboration. And for one reason is to eradicate polio, but there are many other diseases. And COVID is showing us that, you know, such diseases require international collaboration.
And if I could add to Michel's comment, I'm sure you spotted his first two slides in which he laid out a timeline over the first 30 days after the first case of COVID-19 was first surfaced within China, and all of the things that had been accomplished within 30 days. That doesn't sound to me like any delay in response.
Okay, this is a little bit long. I'm going to try to read the whole thing so you get the question at the end. We learned that there is no lab to diagnose polio virus inside the country of Afghanistan. Having one would shorten the time for diagnosis. Recognizing that there are a lot of issues around building a lab and training personnel, is this the kind of effort Polio Plus funds would go to, and is it a possible future project?
I can take that question, Chuck, if you wish. This has been an issue for some time. In fact, the samples of the stool specimens are being shipped to Pakistan for testing to detect the virus. And indeed, the Afghanistan government has been keen to establish a lab for some time. There are several sort of projects underway. It is a very costly enterprise. And the question is it worthwhile establishing this lab now when we're so close to finishing the job because it's a huge investment? Or, you know, should we actually not do it? I think that the decision has been taken, but it's going to take time to establish the lab. The decision has been taken to actually sort of create that laboratory that will serve Afghanistan beyond eradication. It will look at other sort of infectious diseases, but it's a long process and quite costly.
Thank you. Because polio can be spread through poor sanitation situations, should Rotary focus on clean water and the elimination of trash?
I think certainly Rotary should continue to focus on clean water. That's one of the most popular of all of the areas of focus within Rotary. That's a way of keeping or holding down the spread of any type of disease, to include polio. The best way we can stop polio now, though, is to interact and interrupt the polio virus in those last two endemic countries of Afghanistan and Pakistan. If we can do that, that will go a long way to at least removing the fact that even poor sanitized countries, that you can still get a polio. You'll be able to get other viruses perhaps, but we will have taken care of polio. We must get rid of the wild polio virus.
A follow-up.
if I may add, Ashley, sanitation, as Chuck is saying, is critical, and Rotary, even in Pakistan, in Karachi and other places, is actually financing access to safe water. But this is a very long process to actually give access to safe water and sanitation to all communities that are living in difficult areas. So Chuck is right. If we want to eradicate polio, let's focus on vaccination, but let's not stop also our efforts to support improved sanitation.
Thank you. A follow-up from the cost question earlier. Does the 50 cents stated include all the logistics or just the vaccine itself?
That's the cost of the vaccine. It's approximately 15 cents for a dose of vaccine, so 45 cents for the course of 3 doses. The cost of the cold chain, transport, and so on adds on to that, and you would actually double the cost roughly. Make it $1 with all the logistics and the cold chain required.
Thank you. How long after eradication would we need to continue to vaccinate against polio worldwide?
That's yours, Michel.
Yeah, this is a complex question. In principle, after the last case is detected, we will need 3 years, approximately 3-4 years in Africa, to confirm, to certify eradication, to make sure that the virus is nowhere. So then we can certify eradication. And after that, we first need to withdraw all oral polio vaccine, as Chuck has said, and move to the injectable vaccine, the killed vaccine. We say that we should actually vaccinate with a killed vaccine for at least 10 years after eradication. Here is the fact that there are viruses in many places in the world, in laboratories or plants which manufacture the vaccine. And we need to make sure that there is a very strong containment of these viruses to make sure they don't get sort of released into the public afterwards. So, you know, if in principle you could think that you can stop vaccinating, it's probable that people will want to continue to vaccinate, you know, as part of a combination vaccine for, you know, a very long time, and not take the risk that the virus could actually be reintroduced either by accident or intentionally.
And it looks like this may be the last one, so if anyone does have any other questions, please go ahead and type them in. What did we learn when we switched from tri to bivalent? Were there mistakes making that decision?
Do you want me to take that, Chuck?
Please, Michel.
Well, I'm afraid to say yes. When we moved from trivalent to bivalent vaccine, we did it for very good reason, for the reason that the type 2 vaccine virus was causing, as Chuck has shown, a large number of vaccine-derived outbreaks. And since the wild type of the type 2 had been eradicated, there was no more ethical reason to continue to vaccinate. Now, certainly, in the past 4 years, we've seen that the withdrawal of the vaccine was done well. You know, 150 countries withdrew this vaccine, but the result has been that gradually we had large number of outbreaks. So we did not have the tools to properly withdraw this vaccine. And the tool we hope is going to be this new vaccine, this new oral vaccine that can help us stop the outbreaks without sort of the risk of seeding new outbreaks. So at that time, the mistake that was made, we did not know about it, is that the tool that we would use could actually sort of eventually become sort of the source of more outbreaks. So I think in hindsight, it was the right decision at the time, but probably, you know, it has led to a situation which is now telling us that we did not have the proper tools to enable us to withdraw the vaccine. And this tool is what we are developing now, and we hope to roll out in the next few weeks.
Okay, we did have a few more come in during that final call, so I think we'll be able to get to one, maybe both of them. Has there been any COVID-19 cases in any children who have polio in Afghanistan or Pakistan? And what would be the potential long-term effects of children having both?
I have no information on that.
No, I don't have information on that. It's likely that children have been affected by COVID, but as you know, children don't suffer too much from COVID. On the other hand, our health workers, our workforce has been affected by COVID in doing their job that Chuck described so well. And we even had 3 of our staff die in Somalia and in Afghanistan from COVID as a result of doing their duties. I'm really apologizing. I have another intervention just now for another Rotary Club in the UK. So I'm going to leave you, Billy, apologies, Chuck, apologies, Ashley, apologies. And thank you very much all for your continued support to polio eradication. We will make it. As Chuck has said, we need to continue and raise the funds to actually finish the job. Thank you very much.
Thank you so much. And with that, let me go ahead and take over the mic, Ashley, if you don't mind. I do want to recognize a few individuals. One is John Clark, who just signed off. I hope he didn't. He's the one that actually who was responsible for us getting Michel Zaffran. So thank you very much for, oh, you're still on. Okay, great. I didn't see you earlier. All right, so John Clark is from Lakeshore Savannah Park Rotary Club. Thank you so much for doing that. And this presentation, this virtual event, I should say, ran pretty smoothly, and we had a tight timeline. And I thank everyone. There was a lot of people I want to recognize right now. One is Ashley. Behind the scenes, we've been doing a lot of work, all right? So Ashley was one of our key contributors. Thank you so much. And Sonia Liu, I've got to recognize you also because you've done a lot of work for this event. And so thank you so much. Chuck Davidson, as usual, thank you, sir, for coming, participating, and providing us with outstanding information that we could use. And let
Pleasure was mine, Billy. Pleasure was mine.
Great, thank you. So let me say one thing, something of a personal note. As a polio survivor, I'm encouraged and pleased to see a bunch of individuals, you know, no one's getting paid for this, right? Come out on a Saturday and do a lot of different work, you know, on the back end, you know, and the goal is to eradicate polio. That is just amazing, you know, that we as individuals could do that. And believe me, you have a tremendous impact on the world. And I'm just very touched and pleased. Thank you so much. And with that, I'm going to turn it over to Jimmy Gorski to end the session.
Thank you. Thank you, Billy. Thank you very much. And I'd also like to say a personal thanks to our speakers, Dr. Davidson and Dr. Zaffran, for helping us join the conversation to learn the latest information on Rotary's efforts to eradicate polio. As most of us know now, over 1 million Rotarians around the world have raised funds, immunized children, and promoted vaccinations. In fact, by working together with our partners and governments across the globe, we've been successful in the immunization of over 2.5 billion children in over 100 countries. With our combined support, our plans hold that polio could be the second human disease to be eradicated following smallpox. As our leader, Rotary International President Holger Knack has said, we can fulfill the promise we made to the children of the world. Our efforts continue, and we welcome your generous donations to our District 7620 End Polio Now campaign. Thank you, End Polio Now Chair Billy Lewis and his industrious and tireless committee, our Public Image Chair, Ashley Waters, certainly our District Rotary Foundation Chair and past District Governor, Rich Glover, and all who are part of this event today. And now I'm District Governor Jimmy Gorski signing off for now.